What does Medicare cost in 2024? In this video, I'm going to explain the costs to expect on original Medicare, a Medicare Supplement plan, or a Medicare Advantage plan. Hey guys, Alex Wender here, founder of Blue Wave Insurance Services, where we help folks across the country with their Medicare and retirement needs. So when comparing a Medicare Supplement plan versus a Medicare Advantage plan, it's always important to consider cost because that's always a big factor. So let's look at the options between Medicare Advantage and Medicare Supplement cost-wise in 2024. So first, let's cover the basics. There are two plan types to choose from when you're on Medicare, either a Medicare Supplement plan, also known as Medigap, or a Medicare Advantage plan, also known as Part C. So let's first go over the difference between the two. Medicare Supplement plans pay second to original Medicare. They allow you to go to any doctor anywhere in the country that accepts original Medicare. In addition, any charge that is approved by Medicare will be automatically approved by the supplement carrier, and that claim is paid directly to the provider, the doctor's office. It's important to know that Medicare supplement plans do not cover dental, vision, or prescription coverage. Those have to be purchased separately, and the prescription plan is separate and referred to as what's called Medicare Part D. Medicare Advantage plans, in contrast, take over original Medicare and become primary. They generally come in the form of an HMO or PPO plan, and these combine parts A and B together. These plans often include prescription drug coverage and also extra benefits such as dental, vision, and fitness benefits. So let's talk about parts A and B. Medicare Part A. This should be free if you have worked for 10 years and have 40 working credits. You can check this by logging into ssa.gov and viewing your account online. The Part B premium is $174.70 per month in 2024. That's what most folks will pay without what's called an IRMA adjustment. IRMA stands for Income Related Monthly Adjustment. The IRMA look back is 2 years and it's based on your income. So in 2024, the government will look at your gross adjusted income in 2022. And in 2025, they'll look at your gross adjusted income in 2023. So here is a quick look at the IRMA chart for 2024, which shows the adjustments for income based on how you filed your taxes, either jointly or separately. Also, keep in mind, there is an IRMA adjustment on the Part D side as well. So a lot of folks, that catches them off guard. They sign up for a Part D plan, and then they have an extra charge because of the IRMA. So keep that in mind. Now for the drug plans, there is a wide range in the drug plan premiums in 2024. Now these change annually, but most of the plans in 2024 are between $0 and upwards to $100 a month. There's a wide range, but most of our clients and most folks are under that $20 per month range, just to give you an idea. Now let's take a look at the prices for Medicare Supplement plans. With a Medicare Supplement, you would retain original Medicare A and B, and you would have a standalone drug plan. So it's A and B, Medicare Supplement, and standalone Part D drug plan. Now the premiums can range depending on the factors on the supplement plans, such as your age, your gender, and your location, and of course the insurance company offering the plan. Typically, premiums for plans G and N, which are the most popular plans, range between $80 to $175 per month. And this can be more or less depending on factors that I mentioned, again, age, location, gender, and the insurance company. For example, a Plan G for a 65-year-old female in Houston, Texas, ranges between $100 to $220 per month, depending on the insurance company offering the plan. Because Medigap plans are standardized and carriers charge different prices for the exact same plan, it can make sense to go with a carrier that's offering a competitive premium. Now, Plan N, which is another popular Medigap plan, in that same zip code, starts at $90 per month for a 65-year-old female. Medicare Supplement plans, overall costs. Now let's recap the overall cost if you went with original Medicare, a Medicare Supplement, and a Part D. So your Part A should be 0 or will be 0 if you've worked for 10 years and 40 working credits. The Part B without an IRMA adjustment is $174.70 per month. The Part D will range depending on the plan you go with, between 0 to 100. Again, most folks are in that less than $20 range per month for the Part D in 2024. The Plan G or N, that will range between $80 to $150 per month. That can go up or down depending on where you live, your gender, and your age. So average total per month, now this can be more or this could be less, but just to give you an idea, without an IRMA adjustment and the original Medicare with the supplement and Part D should be around $300 per month. Your out-of-pocket cost, other than the premiums each month on Plan G, is just the Part B deductible, which is only $240 for the entire year. So there's no co-payments on Plan G, you just have that flat deductible. In 2024 is $240. On Plan N, you have that same deductible of $240 per year at the doctor's office, and then your co-payments will range between $0 and $20 at the doctor's office and $50 at the emergency room unless you're admitted. Also on Plan N, Part B excess charges are not covered, and you can easily check if your doctor takes Medicare assignment on medicare.gov, and that will help you avoid excess charges. For more information on Plan N, see my video below in the description. Now let's talk about the cost on the Advantage plans. The Medicare Advantage plans combine Medicare Parts A and B and often had prescription drug included as well. Typically, these are $0 per month, depending on where you live and what plans are available. So your Part A again should be 0 if you have that 40 working credits. Part B, $174.70 per month without an IRMA adjustment. And then your Part C, typically with the drug coverage, is 0. So your total is only the $174.70 per month. Now let's talk about some of the potential out-of-pockets on the Advantage plans. Now these out-of-pockets can range depending on the plan and the plan type, but most plans will have a maximum out-of-pocket for the year of $3,000 to $7,000 per year. So that's the maximum out-of-pocket, or the most you'd pay, also known as a stop loss on the plan. Typically, there will be co-payments at the doctor's office between $0 to $30 or more per visit, depending on the plan. Some plans are just 0, some plans are more than 0. There are other costs associated with using the plan, such as co-payments at the emergency room, urgent care, hospital stays, and other services. For this reason, we do recommend our clients at least consider a hospital indemnity plan if going with a Medicare Advantage plan to help with those out-of-pocket costs. And that hospital plan, if it's available in your state, typically has a rider for cancer diagnosis, so that can help with out-of-pockets associated with cancer treatment, and also you can add coverage for heart attack or strokes as well. The Advantage plan is more of a pay-as-you-go type plan, as the premiums tend to be 0 or close to it. Also, keep in mind there are network restrictions on most Advantage plans, so you need to make sure your doctors are in the plan's network, and you may need to see referrals for certain specialists depending on the plan as well. If you enjoyed this video, don't forget to click subscribe and like below so you can stay updated on all things Medicare and get the latest updates on changes. For more information on Medicare and to compare your plan options, feel free to give us a call at the number below or book an appointment with one of our agents using the link in the description. Thank you for watching, and we'll see you in the next video.